Welcome to The Explainer. Today we're tackling a really interesting topic, one that's super popular but also kind of controversial. When it comes to muscle pain, dry needling. So what's the deal with it? Does it actually work? And maybe most importantly, is it safe?
Let's kick things off with a number that's, honestly, it's pretty staggering. $1.71 billion. Just think about that. That's how many people all around the world are dealing with things like back and neck pain. We're talking about almost a quarter of everyone on the planet. It's this huge shared problem.
So, with that many people in pain, you can bet everyone's looking for a solution, right? And one treatment that's really exploded in popularity, especially in physical therapy and sports medicine, is something called dry needling.
Okay, so what is it? Well, it's pretty much what it sounds like. A physical therapist takes this super thin needle and inserts it right into what they call trigger points in your muscles. You know those really tight, sore knots you get? Yep, that's what they're targeting.
And the whole idea, the big promise here, is pretty simple. The goal is to get right to the source of the problem, to relieve pain and help you move better, especially if other treatments haven't really worked for you.
And wow, they use it for a ton of different things. We're talking about all sorts of common problems. You've got your everyday neck pain, those awful tension headaches, but also more specific stuff like knee osteoarthritis. Oh, and for all you runners out there, even that super annoying plantar fasciitis.
Now, there's a good reason it's so popular, right? For a lot of folks, it seems to work. The research backs this up, showing it can be pretty effective for pain relief and getting you moving again. But here's the catch, and it's a big one. We're talking about short-term results.
And you see this a lot in the world of sports medicine. It's become a go-to for helping athletes deal with pain, maybe speed up their recovery, and just get them back on the field or the court.
Okay, but that's only half the story. Anytime you're talking about a procedure that, breaks the skin, we absolutely have to talk about the other side of the coin, the risks. So yeah, let's dive into that. How safe is this stuff, really?
Well, when you look at the data, you kind of see two different buckets of risk. In one bucket, you've got the minor stuff, things like soreness, a bit of bruising, maybe some light bleeding. And that stuff is pretty common. But in the other bucket, well, that's where the serious, documented harms live. And they definitely can and do happen.
And look, this isn't just a few stories here and there. A big, comprehensive review dug into this exact question. They looked at tons of studies and basically created a catalog of all the risks that have been reported. And this is the really critical part. Even though these serious events aren't super common, they are a big deal when they happen. We're talking about things like a collapsed lung, that's called a pneumothorax, which can happen if a needle goes too deep near your chest. There are actual documented cases of nerve damage causing long-term problems and even really bad infections.
Okay, so if we know for a fact that there are real risks involved, it makes you ask a pretty important question, doesn't it? Just how solid is the science that says this stuff works in the first place?
And the answer here might actually surprise you. When scientists bundle all the studies together and look at the big picture, they keep coming to the same conclusion. The overall quality of the evidence is, well, it's pretty low, sometimes very low.
So why is that? What's the problem? Well, a lot of the research just isn't built that well. You see studies with only a handful of people, or they don't follow up long enough to see if the pain relief actually sticks around. And a big one is that they often don't do a great job of tracking and reporting all those bad side effects.
So the takeaway from the people who study patient safety is really straightforward. They're basically saying, hey, dry needling has a real risk of harm. It's not zero. And the way we're currently studying it and keeping track of those harms, it's just not up to snuff.
All right, so after all that, what's the bottom line? If you're the one with the sore back or neck, how are you supposed to think about all this?
Well, here's a good way to frame it for yourself. Step 1, know what you're hoping to get. It seems like short-term pain relief is definitely on the table. Step 2, you've got to be honest about the risks, both the small stuff and the really serious stuff. Step 3, remember that the science on whether it works long-term is still kind of fuzzy. And really, the most important part is to take these points and talk them over with a healthcare professional you trust.
So, in the end, it really all boils down to one critical question, and it's a personal one. Is the potential for relief worth the potential for risk? And that's a question that only you can answer, but you shouldn't answer it alone. It's a conversation to have with a provider who really understands your specific situation.